Hey, Dr. Sandoval, this dosage calculation feels like the answer should be a relatively small number of milliliters, but I can't quite get my head around how to set it up. The problem says Placebosol 1.5 milligrams per kilogram is ordered for a child weighing 27 pounds, and it's available as 75 milligrams per 3 milliliters. How many milliliters must the nurse administer? Where should I even start with this one?
This problem has a couple of key unit conversions hiding inside it that can really trip people up, Priya. Let's break it down first. We're given an ordered dose of 1.5 milligrams per kilogram, a child's weight of 27 pounds, and the drug's concentration as 75 milligrams per 3 milliliters. Our ultimate goal is to find out how many milliliters the nurse needs to administer. What's the very first piece of information we need to work with, keeping in mind the dose is per kilogram?
Well, since the order is 1.5 milligrams per kilogram, I guess we need the child's weight first. It says 27 pounds. Should I convert that to kilograms right away, or can I just use the 27 for now?
You're absolutely right, Priya. That's the first critical step. Since the dose is ordered as 1.5 milligrams per kilogram, we must convert the child's weight from pounds to kilograms to maintain consistency in our units. Go ahead and convert 27 pounds into kilograms for me.
Okay, so converting 27 pounds to kilograms. I remember it's about 2.2 pounds per kilogram. So I would do 27 pounds divided by 2.2 to get kilograms, right? Let me try that. I get approximately 12.27 kilograms.
Excellent, Priya. That's precisely right. 27 pounds divided by 2.2 pounds per kilogram equals 12.27 kilograms. This conversion is crucial, as you've accurately noted, to match the units of the ordered dose. Now that we have the child's weight in kilograms, what's the next step to figure out the total dose of Placebosol in milligrams for this child?
Okay, so the order is 1.5 milligrams per kilogram, and we have 12.27 kilograms. So for the total dose, would I divide the 1.5 milligrams by the 12.27 kilograms? I'm thinking 1.5 divided by 12.27. That gives me about 0.122 milligrams.
I see what you're thinking, Priya, but let's re-examine the units to make sure we're setting up the calculation correctly. The order is 1.5 milligrams per kilogram. If you divide 1.5 milligrams by 12.27 kilograms, what units would your answer have? Think about how the per kilogram part of the order helps us cancel units to get the total dose in milligrams.
Oh, I see. If I divide, the units wouldn't cancel out right. Per kilogram means for each kilogram, so I should multiply the 1.5 milligrams per kilogram by the child's weight in kilograms to get the total dose. Let me try that instead. 1.5 milligrams per kilogram multiplied by 12.27 kilograms. That would be 18.405 milligrams.
Yes, that's exactly it, Priya. By multiplying 1.5 milligrams per kilogram by 12.27 kilograms, the kilograms units cancel out, leaving us with the total dose in milligrams. So 1.5 milligrams per kilogram times 12.27 kilograms equals 18.405 milligrams. This is the total dose of Placebosol the child should receive. Now that we know the total dose, what's our next step, considering the drug is available as 75 milligrams per 3 milliliters?
Okay, so we have 18.405 milligrams that we need to give. The drug is available as 75 milligrams per 3 milliliters, so I need to figure out how many 75 milligram portions are in 18.405 milligrams, right? I'll divide 18.405 milligrams by 75 milligrams. I get 0.2454. So, is that the number of milliliters?
You're on the right track, Priya. You've identified that we need to use the available concentration. You've correctly calculated how many doses of 75 milligrams are needed. However, remember, the concentration isn't just 75 milligrams, it's 75 milligrams per 3 milliliters. How does that 3 milliliters part factor into finding the final volume?
Oh, right. I need to apply the 3 milliliters. So I take the 0.2454 and multiply it by the 3 milliliters because 75 milligrams is in 3 milliliters. So 0.2454 times 3 milliliters. That gives me 0.7362 milliliters. Is that the final amount?
Yes, that's exactly right, Priya. You've correctly used the concentration to find the final volume. 18.405 milligrams divided by 75 milligrams, then multiplied by 3 milliliters, gives us 0.7362 milliliters. This is the volume the nurse must administer. Before we finalize this, how many significant figures should our answer have, considering the measurements given in the problem?
Okay, significant figures. I'm looking at the numbers we used. 1.5 has 2, 27 has 2, and 75 has 2. The 3 milliliters seems like it might be 1, but usually it's treated like a 2-digit number in the ratio, right? So, if I go with 2 significant figures for everything, 0.7362 milliliters would round to 0.74 milliliters.
You've got it, Priya. Given that the measured values like 1.5, 27, and 75 all have 2 significant figures, our final answer should also be rounded to 2 significant figures. So 0.7362 milliliters correctly rounds to 0.74 milliliters. Congratulations, you've solved the problem. To summarize, we first converted the child's weight from pounds to kilograms, then calculated the total ordered dose in milligrams, and finally used the available concentration to determine the precise volume in milliliters to administer.
Thanks so much, Dr. Sandoval. I feel so much better about this now. Those unit conversions and making sure I multiplied instead of divided really tripped me up. But I think I understand it clearly now. I'll make sure to pay close attention to those details next time.